Hey guys, it's Ryan from Best Face Forward, and in today's video we're going to be focused on can tongue posture and mewing actually affect the shape of your face, because there's much debate on this. And in this video we're going to be dividing it into two sections. The first section is going to be talking about your actual bone, that is your maxilla and your mandible. Dr. Estrabillo is going to talk about, can you actually remodel this bone? Is it possible to make changes? Then we're going to talk about the muscles of your face, your lip muscles, your cheek muscles, your jaw, your chin, and how different fields improve those muscles as well. You've probably heard that it's difficult to make changes to your bone past the age of 25 because you're finished growing. Now, a lot of that has to do with the way that the jaw grows and forms. So there's something called your Palatine Suture, which is basically the suture that divides the bone in your upper palate in two. When we're growing, that bone is not fused yet. So the reason for this can be seen in this study, where patients are put into 5 groups based on their level of mid-palatine suture fusion. So what is that? The mid-palatine suture runs straight along the palate, the upper palate, and essentially splits the bone of the palate or maxilla in two. This suture begins to fuse as we approach adulthood. So that fusion just means that the bones are joined together. In stages A and B, the fusion has not even begun to occur, so this is when you're a lot younger, meaning that it's extremely easy for orthodontists to expand the palate at this age by using a palatal expander. During stage C, the suture is beginning to fuse, however, it's still not entirely fused at this stage, so expansion is still very possible. Then stage D means that part of the suture is fused. And then stage E means the entire maxilla is fused along this suture. So what that means is that it's possible that adults may not have fusion in the suture, but very unlikely up until a certain age. For the most part, we begin to see this fusion take place around 11 to 18. That's why you hear people say that you can't really get results with mewing past the age of 25. However, there's another aspect to it which Dr. Estrabillo is going to talk about, which is bone remodeling.
For the most part, the bone will remodel every year. It doesn't matter what age group we are. Your bone, whether you do something or not, it is going to remodel. But if you want to have a very impactful kind of changes, you could do it in different phases. For children and teenagers, up to their accelerated growth phase. And that is when the child, a young lady or a young man, are growing really fast. From kids up to about, in girls, about 12 to 13, that is their rapid growth phase. And for guys, it extends between up to 15 or 16. With the mouth, you could actually grow the palate in a way that the suture could actually be separated. There's a palatine suture that you got actually split. And you could do that with the aid of an external force. Rapid palatal expander is a good thing to use in those situations. And those bones will refuse back. If you have a nice strong tongue, that will help as well. Remember, it's the force acting on those palatal bones, both the basal and the alveolar bone, whether it's the maxilla or the mandible. At an older age, above 16 to 17 and beyond, can you still expand the maxilla? Some people say they can. Using maxillary palatal expander or mandibular expander, that's hard because you're looking at the basal bone. But one thing I know, if you use an external force right like that, if you use it long enough, your bone would remodel. So yes, you could still change the structure of your face, both maxilla and mandible, if the force acting on it, the external force acting on it, is there long enough. So for most adults, what my experience is, applied light forces. It's a set of wires that you actually use to slowly put forces, continuously put forces on the alveolar bone and into the basal bone. And you would really see the development of the jaw. So there is a distinction between bone remodeling, bone repair, and palatal suture separation. So in this situation, can the tongue influence the growth of your maxilla or mandible? Of course it can. The tongue is a very powerful muscle. If it's fully developed and it's actually consistently acting on the bones, in this situation, your maxilla or mandible, the maxilla and the mandible will actually spread. You could do that laterally as well, because there's also alveolar bone laterally. So with the forces from the tongue plus the normal remodeling, you could actually get that remodeling to remodel in a place where you want it. Alright, in the mouth, where the teeth are, the upper jaw and the lower jaw, we talk about two kinds of bones. The one that is supporting the teeth themselves, that is called the alveolar bone. And the one where the alveolar bone is sitting, it's called the basal bone. Alveolar bone would remodel really fast. The basal bone is a lot harder to deal with. The basal bone, in children, you actually split the sutures to make that bone grow. But also in adults, if you have continuous force as well, that basal bone will also remodel in that position.
So now that you understand that changes are possible at any age, well, that's Dr. Estrabillo's opinion. Obviously Dr. Mike Mew agrees with it. There's others that agree with it, and there's different opinions, which is always good. Now that you understand that bone changes are possible at any age, we're going to talk about something that's has even more potential to change, which is the muscles of your face. Obviously, you guys probably understand that if you have a muscle in your body, that muscle can grow, it can become more toned, it can become more stretched. And these are things that can happen with the muscles of your face too. Like your lips are a muscle, it's called your orbicularis oris. Your cheeks are your buccinator muscles. Then you have your masseter muscles of the jaw. And all of these muscles can be developed, they can be toned, they can be trained so that they function better. They can be stretched in some circumstances. So there are several fields that look into the appearance of your muscles. And one of those fields is myofunctional therapy, obviously, which deals with the function, and then as a result of that is the appearance of the musculature of the face and tongue. And then there's also fields such as the face yoga method and other things that have aimed to deal with these facial muscles and to improve and tone them. Now we actually have a guide that we created with the top exercises that I've found that worked, so I've put that in the description. It's a free guide that you can download. Follow those exercises and you will be able to see changes. Also, you can enroll in our program for the Best Face Forward online program with Dr. Estrabillo that he's doing, and that will help as well. But you know, it's obvious that these muscles can change over time. If you've been a mouth breather, you haven't had the best tongue posture. Your lips have likely lost tone. So have your jaw muscles and likely your cheeks too. So myofunctional therapy exercises actually strengthen and tone all of these muscles. Not so they only function better, but so they look better as well.